enter the room.
Can you hear the...
Yeah.
Hi.
Hello, my GMC number is A0222. May I proceed?
Please proceed.
Okay. Hello, my name is Dr. Rusa Zafar, and I'm one of the doctors in A&E today. How may I help you?
Hi, doctor. I've been throwing up since morning, and my parents
Okay.
insisted that I come to the hospital today.
Okay, so can you please confirm your name and age for me?
Yes, I am Amber. I'm 15.
So yeah, so you are Amber Shelley, am I right?
Yes, that's me.
Okay, so Miss Shelley, can you please tell me more about these vomitings? When did they start?
Well, they just started, today since morning, and I've had like I've vomited about 2 to 3 times now. Yeah, I'm feeling pretty tired after that.
Okay, so are you able to take anything or you're just vomiting?
Um, yeah, I'm just randomly vomiting. Yeah,
Mm-hmm.
this morning. Yeah, I can't keep
Okay,
anything down.
okay. So have you noticed anything that make these vomiting worse or anything that may help you with the symptoms?
Not really, doctor.
Okay. So can you please tell me, did you go out and eat something outside or like anything like that?
Not something out of the ordinary. I mean, I hang
Mm-hmm.
with my friends,
Mm.
sometimes go out and eat, but yeah.
Okay. Okay. And by any chance, did you drink alcohol?
No, I don't actually drink alcohol.
Okay, that's good. That's good to hear. So you said that you have only 2 to 3 episodes of vomiting since morning, and nothing is seems to be improving or aggravating them, right?
That's right.
Okay. So something about your GI symptoms. Is it just the vomiting, or is it tummy pain, or what about diarrhea?
I've not noticed anything like that. It's just the vomiting, doctor. It just comes suddenly, and that whole feeling of being,
Okay.
yeah.
Okay. Any other associated symptoms that you've noticed alongside these vomitings?
Like what exactly?
Like maybe you have dizziness, or maybe you have uh, vertigo.
I kind of feel tired after
Mm-hmm.
that. I've been feeling
Okay.
like since the vomiting episodes, yeah.
Okay. So okay. So Miss Shelley, have you been diagnosed with any sort of medical condition?
No, doctor.
No. Have you taken any medications, including any over-the-counter medicines? Oh,
No, doctor.
no. Are you allergic to something?
No, not really.
Okay. And how's your diet in general?
Yeah, I eat everything. I sometimes eat outside with my friends.
Mm-hmm.
Yeah.
Okay. Okay. And can you please tell me about the activity? Do you do exercise?
Yeah, sometimes. I mean,
Mm-hmm.
I have a gym at school, so
Okay. Any stressors recently? Any stress factors?
not really. Yeah.
Not really. Yeah.
Mhm.
Okay. And so I'm gonna order some blood tests for you. I'm gonna examine you, checking some vitals. Then I'm gonna order some blood tests for you. Would that be okay?
Sure. Yeah.
So I'm gonna order ABGs because and routine blood investigation, infection markers.
All right. Anything else?
And I'm just do check the vitals.
Okay.
Mhm. Okay. So, Miss Shelley, I'm gonna ask you some questions. It may sound intrusive, but I really need to talk to you about them. Are you okay with that?
Oh, I guess so. Yeah.
Okay, so Miss Shelley, can you please tell me when was your last period?
2 minutes remaining.
Oh, I don't know, like around 6 weeks back, I guess.
6 weeks back. Okay, and can you please tell me, are you sexually active?
Uh, um, um, I don't know. I don't want to talk about it.
Yeah, it's a safe place, and it's your information is confidential between us. So please talk to me about that so that I can help you.
I really don't want to talk about this in front of my parents.
Okay. So yeah, they can go out and I can talk to you. How about that?
I don't know.
Okay, so can I ask the parents to go out? So
Okay, the parents.
yeah. So Shelley, are you okay to talk now?
I don't know, doctor. Why are you asking me these questions?
Because from your blood reports, I found out that your pregnancy test was positive. So the vomiting that you're having, it's related to your pregnancy.
What?
It's known as morning sickness, and it happens.
Oh my God,
Yeah.
doctor.
So
I'm not sure what to think right now.
it's completely all right. We are here. We can offer you food in any way you want. Okay, it's completely your choice.
Move on to the next station.
Yeah.
Right. Well, good job, Dr. Arusa. And this is a pretty interesting case that has been coming quite lately.
Okay.
So let's look at the age of this person. So this person's around 15 years of age, right?
Yeah.
And yes, and that's below the legal age to be sexually active. And so she's having morning sickness. She has no idea why she's having this morning sickness. So one important thing is, as soon as a person, and this is for everybody there, as soon as a person with any indications of pregnancy in the sexual age group, that is after puberty, presents, always do a urine pregnancy test. Do not miss that out. That's an important marker. There are various symptoms of pregnancy. It could come as morning sickness. It can even come as erythema nodosum. Erythema nodosum is something that presents in the early stages of pregnancy, in the first trimester itself. So even if you're thinking skin lesions, even especially if they are in the reproductive age group, do not miss doing the urine pregnancy test. That's very important. All right. So that's an important piece of information that you guys should definitely consider, right? All right. So let's look at the presenting the information that we had. So whenever you get candidate information, take every line of the candidate information as an important clue. That's very important. So where is the setting? The setting is the A&E department. right? You're in FY2. This child is 15 years of age, brought in by her parents, right? The parents are with her, right? So there is still an aspect of confidentiality that you need to maintain for such patients, right? All because they are 15, you shouldn't ignore the idea of confidentiality. The whole point of keeping confidentiality is so that, you know, they would be more comfortable to open up to you and they can actually talk about their situation more truthfully. Right. So you need to offer that confidentiality and in its full essence. Meaning, you know, if you're talking about confidentiality and their parents are there, it doesn't mean anything. Right. They wouldn't trust you either ways. You're talking about confidentiality and their parents are already there. Right. So, you know, have a polite manner to actually ask the parents to step out for a moment while, you know, you talk to her about some personal aspects, you know, which you usually do for, you know, teenagers of her age, you know, just something very general so that, you know, they can take the cue and they can kind of step out. Right. So understand boundaries here. And once they do, you can actually start, you know, offer her confidentiality with, you know, especially mentioning that, you know, the confidentiality will be maintained until everybody is safe, until, you know, you realize that there is no harm to herself, there is no harm to anybody else, right? And until everybody is safe. So once you offer the confidentiality, you can move forward with the conversation, right?
Okay.
Okay. Yes, yeah, and in the investigations, unless you actually mention the investigations, you will not get the findings. In this, in the workbench over here, we don't have a way to actually give you the findings as you mention it. But in the real exam, only if you mention what findings or what examinations you would be doing, you would be getting the findings accordingly. All right. So,
Okay.
take it, make it a habit to actually verbalize the examinations you'd like to do, the investigations you'd like to do, right, in order to get the findings. All right, so after that first initial introduction of, you know, idea of where you are, definitely, because if it was a GP setting, the situation would be a little more different. Right, so GP is somebody that you would regularly go to if you have any issues. GP is a person who actually has an idea about your medical records, and you know you are always in an ongoing care with the GP, right? A&E is somewhere where you actually go when you have like a medical emergency, you know, when you think you need to get admitted, right? Not just for a you know, a small checkup or any query. So, you know, the setting is also very important. Understand where you are. Accordingly, you have to give you know, advice. All right, so let's quickly look at the situation. You asked a lot of questions because as soon as the patient comes with vomiting, a couple of things that you need to rule out is any GI infections, any fever. You know, thinking when you're thinking along the lines of infection, think about fever. Right. So have you been feeling hot lately? You know, do you think you're running a fever? Have you measured your temperature? Right. Because in this case, she wouldn't present with the fever itself. Right. So think along those lines. Right. Vertigo is a good one. Right. Any ear problems when you're thinking along the lines of vertigo. Right. Is it intentional? Because it's a teenage girl. So is the vomiting intentional? Any red signs in the vomiting, like any blood in vomiting, right? So any headache, vision changes, abdominal pain, right? Um, and then you asked about medication, you asked about medical history, travel history is also good, but that's all right. I think you mainly covered that, right? So now when you have to start asking about the personal questions, right? How would you go about that, right? So to maintain, so to ensure and maintain confidentiality, politely ask the parents to step out so that you can have a more in-depth and personal conversation with the patient. Would it be okay if I had a few minutes alone with your daughter? I like to give all young people a chance to talk privately during consultations. You know, that's a simple way to actually mention that, right? So, you know, that's something you can actually, that those are the couple of lines you can actually use to politely ask the parents to step out while you actually start talking about the more confidential things, right? Reassure that reassure her that what she says is confidential unless there is a serious risk of harm to herself or others, right? What you tell me would remain private unless you think you or someone else is in danger. I'll always try to talk to you first if I ever have to share information. So, you know, you're actually trying to build a sense of trust so that she can actually share with you her issues and problems. All right. So offer her confidentiality as you're going into the more private aspects of things. Right. So start off with menstrual history, right? And then when you're going into sexual history, you know, always signpost. And I'd like to talk about, you know, certain aspects about your private life, and then start asking questions that way. All right. So now, what is the most important thing if a teenage girl has come pregnant? What are the most important things? What are you? What are the things that you are worried about? And anybody?
Safeguarding concerns.
Absolutely. That's one important thing. Good job, Dr. Sana. So whenever you're thinking about you know, a teenage pregnancy, you have to think in your mind that was she abused? You know, was somebody taking advantage of her? You know, was the relation mutual? Was is the person who is in a relationship with her, is he of you know, much higher age? Right? So when you're thinking along those lines, you're thinking about the safeguarding questions, right?
And
So
the person is not from any like trust as well.
a person is not. Hi, Dr. Vigdan. Could you please repeat that?
The person is not from trust,
From
from
trust?
like NHS, yeah, NHS or some school teacher or something like that.
All right. Yes, yes, yes. Position of power. Yes, that's right.
Position of trust.
Yes. So somebody, yes, from a position of power who is actually taking advantage of her, right? Definitely. Yeah. If there is a school teacher or if it's a doctor, yeah. So not only is it actually frowned upon, it's actually you know, illegal, especially since they are below 16, right? That itself is like, you know, illegal right there. So that's exactly what should, those are the red flags. Those are the most dangerous of cases that you have to rule out quickly. All right. So when you're even thinking along those lines, you have to be very subtle in asking these questions, right? You can't just come right at her and make her feel uncomfortable. All right. So start with sexual activity, you know, like are you sexually active? Since when have you been sexually active? Do you use contraception? What are the modes of contraception you use, right? And how many partners do you have, right? And then once she actually starts talking to you about her partner, then start asking more partner-related questions, right? Like, can you tell me a little bit about your partner? How old is your boyfriend? How long have you been together? Are you currently in a relationship with this person? Yeah. Do your parents or carer know about this relationship, right? So you are trying to bring in that you know, that kind of you know, communication you know, channel between the girl and her parents. So even though you are not forcing her to go and talk to her parents, you still want her to confide in them, right? Because they are her guardians and they would be, you know, a good support for her in whatever she decides. So you need to bring about that sense of security in talking to the parents as well. At these points, try to subtly introduce, you know, the parents aspect so that she feels comfortable talking to her parents, right? So this moment you've actually asked them to step out so that you can have these conversations, but you are trying to make her take that step into, you know, confiding and opening up to her parents so that, you know, the decisions that she makes are you know, decided along with her parents as well, right? Yes. Do you feel you were able to make your own decisions about having sex? Do you feel comfortable saying no at any point? So these are a couple of the safe guarding questions, making sure that she wasn't coerced into, the act itself, right? Has anyone ever pressured you into doing anything sexual that you didn't want to? Has your partner ever made you feel scared, controlled, or unsafe, right? So once you actually understand that situation that actually got her pregnant, and if you feel that it was, something that, was an offensive, abusive, then you can start talking about her options, right? And a couple of other questions like her, as of now, her psychosocial history, like, her diet, her activity. Does she smoke or drink alcohol? Because just so that, she could be in a more healthier state in whatever she decides, right? So, and then you move on to the investigations and examinations, right? So abdominal examination, urine pregnancy, urine analysis, right? And a couple of blood works. All right. And then how do you break this news? So how would you guys think of breaking such a news, such a, you know, heavy news to somebody? Anybody has any ideas or clues? I don't want to show you the management just yet. Yeah, Dr. Vigdan, do you want to give it a try?
Yeah, actually, now she should tell.
Um, I'm sorry, you're muted.
Hello, sorry. Actually, now she should tell her that after doing your test, what I have seen that your the pregnancy marker, which is SCG, is positive. It means that you're pregnant. So for that, I have to ask you, when did you had your last menstrual period?
Oh, you've done the data
Then,
gathering. Consider
sorry?
you've done gathering. Consider the fact that you have done data gathering. All right. You've
Okay.
done
Then
data
after
gathering.
that, just we will tell her that now, according to management, now we have to talk about that. First, we will tell her that she is pregnant, and then we will tell her that I can recommend you to take an antiemetic at the moment and inform your parents as well, in the carer as well, if there is any carer.
All
So
right.
just to let them know as well, take them in confidence and involve your partner as well in it.
Yeah, absolutely. Awesome. Yes, Dr. Chalky, you have something to add. Please go ahead.
Yeah, can we ask the management in this scenario, like asking her first, like what does she think might be the cause of this vomiting? Can we start in that way so that we can involve her in the
I think that's
like.
something that you should ask in the data gathering itself, because over here you actually know what is the cause and you've already asked the related questions,
Yeah,
isn't it?
so I mean, asking just before the management from the patient that, oh, or shall we ask it in the beginning when we are having the data gathering, that what could
So
be the
it's
cause
very
of this?
so this is the idea part of idea concerns and expectations. So it's ideal to actually ask, after you do the Socrates, right? So
Okay,
after you get
okay,
do the Socrates, you yourself have an idea. So you're trying to understand, what does she think? Because if there is any activity that she might have missed and she thinks would have been important to, would have been something that would be going on in her mind that she thinks could be related, then she would mention it. So the whole point of asking ideas, concerns, and expectation, asking her what she thinks, is to understand the patient's perspective of why they are having the symptom, so that if they have any wrong notion, you can actually clear it out for them. All right.
okay.
Does that
Yeah.
make sense? Like, especially
Yes.
when you have the diagnosis and you're trying to ask her, what do you think it is? It
Mm-hmm.
kind of, or because understand, this is a very sensitive case, right? You're talking to a teenager, a 15-year-old, about the fact that
Yeah.
she's pregnant. So you don't really want to, after asking all the questions, you don't really want to get to the fact that you don't want to break the news by asking her, what do you think this is? Oh, it's not what you think it is, you're actually pregnant,
Okay. Yeah.
that
Actually, no,
so
sorry. I was thinking it will be like kind of neutralize it in a way that because she's already having some idea from all the like things. We have definitely diagnosis in our hand, but like you ask how to break that news to her. So
Right. Getting to that,
yeah.
yes, absolutely. That's what's important, how do you break that news to her? Yes, sometimes there might be situations in which you're not thinking along the lines of, what to say, a pregnancy. You might actually go thinking that it might be just a GI problem. So you might have not come to the phase of asking about the sexual history or menstrual history, but you might have done a UPT test. And from the UPT test, you've seen that the UPT is positive. So now you want to get to the fact of asking the menstrual history, sexual history, and some of the safeguarding history. So, you can actually bring about, rather than making her uncomfortable after ruling out all the GI causes, rather than putting a scenario in front of her where you're asking her, yeah, what do you think it is now? Right? Especially after you know what it is. That would come out a little, smug, I would say, due to a lack of
Okay,
a
no, I got it. Yeah. Okay.
right.
Okay.
What
Thank you.
you're trying to do is you're trying to, kind of ease into a very difficult discussion.
Mhm.
All right. So once you actually break the news with her, it's a good thing to ask, could you tell me what's going on in your mind? Right. That would be a good time to actually ask her, what are you thinking? What's going on in your mind? Talk to me, after dropping something so heavy. So something like an Eve protocol. Eve protocol is usually what we usually do in breaking bad news. It's kind of similar to that, after from the history that you have done, from the examination, from the history that you have told me and the examination and investigation that we have done, it it seems that, you're pregnant, right? Your urine pregnancy test has come positive, meaning that you're pregnant, right? Stop
Yes.
there so that she can, that information can sink in, and then ask her, could you tell me what's going on in your mind? How do you feel? How do you feel about the situation, right? So then
Yes.
she would express herself saying that, oh my God, I don't know what to feel. Like, so then, but then again, right? After that, you don't want to tell her to, keep it or to abort it, right?
Yes.
You
Yeah.
decides that. You are
Yeah.
trying to give her that option,
Yes.
right? So
Mhm.
yes, I was coming to the point where, initially, if you hadn't taken the sexual or the menstrual history, but you have done a UPT test in your examination and you have seen that the UPT is positive, so you can have like a segue where you can actually say, yeah, I've done a couple of tests, and before I go on to discuss the results, I want to ask you a few more personal questions. And if the parents are still there in the room, you can ask them to step out, out of courtesy, and you can say that I usually give, young people a chance to talk in a more private way. So could you please step out? So you can ask the parents to step out at this point, because until now you've been thinking along the lines of GI infection, and there was no reason to,
Yes.
ask the parents to leave. Now you're going to talk about something way more sensitive. Right, so that's why you're trying to ask them to leave, so that you can actually have this information. And where do you think this child is going to go after you talk to her about this? It's not like she's going to leave home. She's going to go back to her parents, right? And they're definitely going to be curious. So you want to talk to her about how you can talk to her parents as well, right? So you want to keep encouraging her along the way that, we can,
Mhm.
it'd be great if you actually talk to your parents. So all these aspects need to be in your mind, and you need to, present them slowly to this patient. All
Just
right.
one question. Yeah, sorry, just one question. Will it be possible to finish all the aspects in just 8 minutes?
Yeah, I
You
mean,
have to
it's
take care of NI and like, I mean, you have to take care of it, safeguarding, and then you have to break the bad news, and then you have to provide her the management with options. So
Yeah, absolutely. That is a very valid question. In fact, you have to, at every point, you have to show what are the important things to ask, right? So definitely have the safeguarding questions, as a priority to ask within your consultation time. And, take your time, because in these cases, don't rush it. You will be penalized for, rushing the case. So you are trying to show that you're sensitive. So basically what the examiner is trying to see is how you approach such a case, right? After you finish with the data, so let's have another try with Dr. Arusa again. Let's see how well she is able to do a second time. But if there are any more gaps to fill, we'll actually, we can actually, we can actually talk about any other gaps after the second try. We can talk about that, how to reduce the time as well. But yes, I was getting to the point of how do you break the news. So I explained that from the history you share and the results of the urine tests we've done, it indicates that you're pregnant. Yeah, I understand this might be unexpected or difficult to process. Everyone responds difficultly to this kind of news, and it's completely okay. Right? Normalize the situation, try to understand how she feels. Can I ask you how you feel about the results? At every point, ask her permission from here on, how she feels, what we can offer her, the options that are available, right? Providing reassurance and support. You don't have to go through this alone. There are services and people who can support you no matter what you decide, so that's the thing. You are not telling her what to do, right? But you're still giving her an option of going either ways, and whatever her decision is, you are saying that there are people and there are services that are available that will cater to your needs, right? This is your decision, and we will make sure that you have all the information and time you need to think through your options, right? If you feel comfortable, we can involve your parents or someone you trust, but only if that's something you want. We'll support you either way. That's why don't try to bring in the parents from time to time, right? Whenever you can, important aspects where you can. It's a conversation, so understand how the conversation is going. All right. Explaining the vomiting after that. So the symptom that she presented with, the presenting symptom, always address the presenting symptom. Give something for the presenting symptom, definitely, right? The vomiting you've been experiencing is likely related to early pregnancy. It's quite common, and it's caused by hormonal changes your body is going through, especially a hormone called HCG. This rises in early pregnancy. For many people, this gets better after the first few months, but I understand it can feel really unpleasant and tiring, right? So then you can talk about all the symptomatic relief. You can make it short also. This is just something that I wrote in my words. So definitely you can make it way shorter, that the symptoms that you have been experiencing is, an early, is a symptom of early pregnancy, usually due to the pregnancy hormones. That's it, probably, yeah. Symptomatic relief like oral rehydrating solution or antiemetics if appropriate. You can give anti-sickness medications that is used in pregnancy, cyclizine, prochlorperazine. I'd recommend small frequent meals or snacks, staying well hydrated with sips of water or oral rehydration drinks, and avoiding fatty foods or spicy food if they make things worse, right? The triggering factors, right? Keep that in mind. And now the decision of what she wants to do, right? So now you will be referring her to the GP so that, they can cater to the ongoing care. Remember, I told you, always understand where your setting is. So this is the setting, which is the A&E. So the person that you actually go for this ongoing follow-up care is the GP. So with her permission, you can actually share the information with the GP as well, so that any further information, instructions, the GP themselves can actually provide, right? Or you can actually direct them into specialized services like the National Unplanned Pregnancy Advisory Services, right, for pregnancy and their management. Right? So what do? They actually give you an option of what all you can actually do with your pregnancy at this point. They will support it if you choose to continue with the pregnancy, and they would also support you with ways in which you can terminate the pregnancy, right, depending upon how far along you are. And if you are also willing to continue with the pregnancy and give the child up for adoption, that is also something that you can actually they can actually help you. Hi,
I think
there is here. Hi,
Should
Dr.
I add
Vignesh.
something here? They
Oh,
will send her to the hospital and tell her to, first they will tell her to go to her GP and then get it enrolled with the hospital as well, because GP will send her to the hospital, and then early pregnancy assessment unit as well, so that they can follow up her regularly. And we will provide her the leaflet as well, so that she can read it about the early pregnancy and how to be safe, and what she should do for the care. I think so. We should add all of these things as well.
All right. So I just want to tell you guys, if you want to say something, there is a button over here where you can raise your hand. So I'll just finish making my point.
I was just trying to see, Doctor, where is that button?
Okay. So at the bottom, if you can see the call button, right next to that, there is a hand button. Can you see that? Yeah.
There is a face button only there.
Next to that, there's a CC, and then there is a hand button. Or even if it's a face.
Yes. Now I found it. Yeah.
Yeah, no problem.
Thank you. Yeah.
You brought up a lot of important points. Yes, the early, what to say, pregnancy assessment unit. So this point, you are not trying to overwhelm them with information. You're trying to give them options. GP is not something that you have to refer them to. All right, only if they are comfortable. So there are times where you can just refer them to the NUPAS directly. You don't even have to go through the GP at all. All right, so GP is something that you will be explaining, that they will actually look into, your ongoing care, and they'll cater to your needs as per your decision. Now, this is a very heavy decision on this person. What if they don't want to even go for the early pregnancy assessment unit altogether? They just want to, get rid of the pregnancy immediately. That's also an option that can be given, right? So these are so what exactly NUPAS actually offers. I'll just finish this point. Is a way to let them talk through their options, give them a chance to understand what their options are, and then give them further refer them to centers that will cater to these options. Yes, Dr. Vikram, go ahead.
Yeah, what I think that if such a patient will come to me, because I was working in Ireland and I have seen this kind of patient as well, like the similar age, and the parent brought her here to me to the A&E. In that, what we used to do, that we will refer her, but ask her that are you happy for us to refer you? And if she agrees, then we will do. And if she disagrees, we have to inform her that like everything we have to tell her, that if we are not going to refer you, how you are going to manage, and like the counseling procedure, then we'll start.
Absolutely, absolutely. So that's exactly what I'm saying. At this point, you have to make sure you actually tell them of all the different options. And this is a lot of great discussions we are having here. Thank you so much, everybody. I'll just be linking. I'll be just asking the examiner to put our WhatsApp group on chat. So if you guys are not already a part of our WhatsApp group, please join us. And if you have such, interesting opinions and comments and any other management that you would like to share, you can always share it in our WhatsApp group as well. Yes, Dr. Vidhan, I completely agree with that. In fact, at this point, the first presentation, you're basically trying to talk them through the processes, all the, resources that are available to them, right? You are actually asking them, to, keep an open mind about things and understand their different options, right? And as soon as they do make a decision, where to approach, right? Where they can actually go and, fulfill whatever the choices that they have made, right? So absolutely. And these are the centers where you would actually be referring them to. You can send them to the GP, you can send them to NUPAS, and further on understanding their, choices that they have made, they can move forward in that direction. Yes. Yes, Dr. Vidhan, you still have something to add? Oh, Dr. Abraham is also raising his hand. Hi, Dr. Abraham, you have something to add? Please go ahead.
Yes, please. It's not adding. I just want to ask a question. I think at this moment I'm a bit confused, though I joined a bit late to finish the presentation. So it appears as if this is an unplanned pregnancy.
Yes.
In that case, what is the difference between a planned pregnancy and unplanned pregnancy, and then where to refer them? Because I'm thinking the early pregnancy assessment unit will be for the person that she's happy with the pregnancy, the planned date.
Yeah.
That's what I'm thinking. Why the no pass is for those that the pregnancy is unplanned, you understand? And then they can go talk through what the outcome of the pregnancy will be. So I just want to be clear about it, please, because I'm a bit confused now, because if it's an unplanned pregnancy, why are we sending to early pregnancy assessment unit? But there should be different.
That's definitely a good question, Dr. Ibrahim. So we actually, this is basically a teenage pregnancy. So, so this is a 15-year-old child who happened to be pregnant and presented with morning sickness. So we are talking along those lines. But that's a very good question. Like, even when they are of their legal age, it might be planned or unplanned. So, when you're thinking along the lines of pregnancy, it's always a good question to ask the LMP, right? And you can always, in the sexual history, you can talk, or you can also start talking about your stable partner, right? You can also talk about the partners, since once you actually understand that the LMP is a little longer than expected, you can actually go into the topic of, whether are you actually planning pregnancy anytime soon, right? And then according to the outcome, then you can actually congratulate, or depending on their intention, you can actually refer them accordingly. That's a good question. Yes. So going forward, so that is one way to actually understand. So because a lot of medications are also contraindicated when you're planning pregnancy. Right. Dr. Aisha, I'll just get to you in a moment. So whenever, especially if they are on anti-epileptic medications like sodium valproate, right, phenytoin, or if they are on lithium, or if they are, even if they're taking carbimazole, right, you are thinking along the lines of, if you understand that the LMP is more than, say, 3 weeks or 4 weeks, you're actually a little worried about, are they planning pregnancy? Because according to that, you actually have to stop these medications. So whenever you get an LMP, think about always asking LMP for a lady in their sexually reproductive age group, right? And if you get an LMP which is longer than, say, 3 to 4 weeks, more than 3 to 4 weeks, you have to think along the lines of medications. You have to think along the lines of if they are actually planning this, right? And then you can give advice accordingly. Yes, Dr. Aisha, you have something to add.
Yeah, hi.
Hi.
I have a question.
Yes, go ahead.
Yeah, if like this patient presented with vomiting, and if in this case we are thinking like it might be the GI cause, and we have not asked related to the menstrual and the sexual history, but on the urine pregnancy test, it become positive, then we then say that before jumping to the management, I need to ask some personal questions, and in that moment the parents are there. So I have a question, like we offer by ourselves that to the like we say to the parents that please give us space, or if she is hesitant, then we offer. Like I have this question.
So whenever you're going to be talking about something as personal as sexual history, it's better to actually do it in a private environment. Right. At this point, you have to give, you have to treat as though the patient, especially 15-year-old, they haven't spoken to their parents about, their sexual activity. So if you are venturing into that kind of a line of questioning, it's better to actually ask the parents to give you the room in order to discuss things more openly. Right. So that is a good practice to follow. So that's the thing, right? In this case, mainly they're trying to see is that anybody in the reproductive age group, do you do a UPT, right? So it's safer to do UPT. So this case actually brings out that point, right? Anybody in the reproductive age group, if they come with symptoms of GI symptoms, don't exclude the fact that they are not pregnant. It's very important, sorry, to keep in mind that they could also be pregnant, Right, so that's why this is a little bit of a tricky case, because this is a 15-year-old child coming with vomiting. You wouldn't straight away think pregnancy, right? You would be excluding everything else before you start thinking pregnancy, and you would, just to be safe, you would be doing a UPT. So that's why it's always keep in mind, anybody in the reproductive age group, no matter the age, if they are if they have reached puberty, think about doing UPT. Right, so that's one takeaway that we can get from this kind of a case, right? So and if you haven't asked the sexual and menstrual history at that point, you do want to start that conversation. So at this point, the parents don't know what it is. You have the results. The only person who knows that pregnancy is a very likely presentation. At this point, you're the only one who knows that. So how do you start this communication? Start by actually talking to the parents, asking them to step out, right? One good way to say that, would it be okay, I'll just highlight that line, would it be okay if I had a few minutes alone with your daughter? I'd like to give all young people a chance to talk privately during consultations, right? So you're actually asking them to step out, because now you're going to get into that discussion, and you can ask them to step out, and then you can start talking about the menstrual history, and then the sexual history, the safeguarding history especially, and then you can bring it in with the management by starting the explanation of the condition. Yes, Dr. Chavi, go ahead.
I'm sorry for my ignorance, but I just wanted to ask, in these kind of scenario, will we will be having two patients, like two persons in the room? Like, will there be a parent with the child in the consultation room? How the scenario?
That's a good question. In fact, this is something that we are only hearing from the students, right? So we can't really say for sure that this is going to be the case. But in the candidate information, if you see, it's already written that she's with her parents. So now, basically, the PLAB2 is trying to test you on different scenarios, putting you into different situations like these, right? How do you deal with such a situation? So you have to be prepared. No matter what the situation is, be prepared. Understand what have a plan of what you need to do. If there are parents, now you know what to do. If there are no parents, then it's pretty straightforward. You don't really have to ask anybody to step out.
Yeah, but if there are parents, then we really ask them to go out, and then yeah.
What would you do in a real life scenario? Yes, you would. You would ask them to
No. I mean, not of course in the real life. I'm asking about this, like, scenarios. There are two persons, and then we really need to. Okay.
So PLAB2 is basically a simulation of real life situations, right? So what exactly happens is all the FY1s, GPs, all the scenarios that they have actually had in their consultations, they have filed it together and see how, preparing for PLAB2, how they perform in such a situation. Right, so definitely they want to see how do you perform in that situation, right? All because the parents are there. Do you get awkward and say, okay, I'm just going to ask you about your sexual history now? So you would get the reaction of what any teenager would actually give at that point. Like, I don't want to talk in front of my parents. I don't want to say anything more. Yes, Dr. Aisha, you still have something to add?
No, doctor, I got the answer.
Awesome, great. That's great. I mean, this has been quite a discussion, and I think it has been a very important one as well, because this is a little bit of a different scenario, what you usually don't get, but that's exactly what we have to be prepared for. You have to be prepared for anything, right? So yes, let's quickly look at the performance. Dr. Arusha, are you still around? I hope you're still around.
Yes, I'm still here.
Yes. All right, let's quickly look at the performance then. So confirm Amber's full name and age. Good job. Open with the presenting complaint. Can you tell me about what brought you to the A&E? Remember, this is A&E, right? Explore vomiting in detail. Ask about onset, frequency, content, amount, and timing. Ask about associated symptoms, because you're trying to rule out any red flags, right? Right. Even it could be, I mean, for an older person, but just thinking along the lines of vomiting. Is there headache? It could actually be a subarachnoid hemorrhage. Just think of red flags and quickly rule them out, right? Do you have any headache, abdominal pain, right? Dizziness, diarrhea, right? Explore past medical history, ask about any prior similar symptoms or any chronic illness that she might be having. Ask about medication and allergy history. Ask about the recent travels to rule out, travel-related GI infection or foodborne illnesses. Politely ask the, so now, either you have the whole ask, you want to ask about the sexual history, so you have that in mind. So you may ask the parents to step out at this point. Or maybe you don't think about, pregnancy right away. So you would do the examination and you would see that the UPT is positive. And then you want to talk about the pregnancy and menstrual history. So basically, whenever you are planning to talk about the most sensitive aspects of the consultation, ask the parents to step out. All right. Until then, whatever you discuss can be discussed with the parents as well. In fact, they are the ones who brought the child. And it's their child and she's still underage. So keep that in mind. Prematurely don't ask the parents to step out, especially when you're asking about GI symptoms and all. You don't premature GI symptoms and past medical history. You don't really want to ask them to leave at this point, right? So make sure when to ask the parents to leave is also very important. You don't want to do it unnecessarily. You want to do it for a purpose, right? Okay. Reassure the patient about confidentiality by explaining that what she shares will remain private unless there is a serious risk of harm, and that she will be informed before anything is shared. Menstrual history, ask about her last menstrual period, regularity, duration, and any recent changes. Assess sexual activity and contraception, right? You need to understand, if she's sexually active, what is the mode of contraceptions that she has been using, right? Sexual and safeguarding history, ask sensitively about sexual activity, number of partners, contraception use, partner's age, relationship status, and any coercing, consent concerns. Ask about psychological history, includes school life, dietary habits, exercise routine, smoking, alcohol, right? Anything that would be at risk for her at this point. Perform a general physical examination, including assessment of dehydration, vitals, such as temperature, pulse, blood pressure, respiratory rate. Perform focused physical and bedside assessment, including abdominal examination, urine pregnancy test, urine analysis for pregnancy-related causes, UTI or dehydration. Right, now we're going on to the management. Explain diagnosis clearly, discuss the results of pregnancy test in a sensitive manner. The test we did show you're pregnant, which can explain the vomiting, right? Bring in that correlation of vomiting and the results from the test, right? Acknowledge emotion, emotional response. I understand this might be a shock. How are you feeling? So something, treat it like, how you would do in a Breaking Bad news, after dropping the heavy news, give them a certain amount of time to process that information. Right? Use the Eve protocol, E. Understand the emotion. I can understand that you could be in a state of shock right now. We validate, anybody in your position would feel this way, and empathize. I can only understand, I can only understand what must be going through your mind. Would you like to share it with me, right? Offer reassurance and support. Emphasize that she is not alone and support is available regardless of her decision. This is an important point. Explain cause of vomiting, describe pregnancy-related nausea linked to rise in HCG in understandable terms. Symptomatic treatment, offer safe antiemetic in pregnancy like ciclizine, prochlorperazine, if clinically appropriate. Dietary advice, what all she can actually do for the vomiting. Dietary advice, recommend small frequent meals, hydration with ORS, and avoid spicy fatty food. Involvement of parents or a trusted adult, reassuring Emily that this will only happen with her consent and that support is available regardless of her choice. Reassure Emily about confidentiality and support services that are available. Refer Emily to the GP or the NUPAS for further advice on managing the pregnancy. Ensure proper documentation. This is very important, So now you've had this very difficult conversation with this person. You have to make sure to document, right? This is very important about what you have explained, what you have offered. Make sure that documentation is there, right? Record filing, diagnosis, decisions made, and any safeguarding concerns. Provide safety netting, advise to return or seek help if symptoms worsen, new symptoms appear, or if she feels emotionally overwhelmed, right? Like to actually tell her when to seek help, right? Schedule a follow-up appointment for continued support and monitor her condition. Yes, Dr. Aisha, you have something to add. Go ahead.
Yeah, doctor.
Mhm.
She
Sorry.
doesn't open and we say that whatever.
I'm sorry,
Yeah.
your voice was, can you repeat that, please?
Can you hear me now?
Yes, yes. I'm hearing you.
Hello.
Please go.
Yes. Doctor, I'm asking about the confidentiality. Like when she doesn't open and we say that whatever you say, it will be confidential. Like, but when we ask history, like related to the sexual history, and when come to know that her partner is not of her age, like some teacher or a counselor, and that at that moment we have to involve the safeguarding team, and it means that we will break that confidentiality. So it won't make issue that initially we say that whatever you say, it will be the confidential, and then we break it.
A- Amazing question, and this is a question I was hoping that somebody asked. Definitely, this is a very important question. So when you're talking about confidentiality, confidentiality has its limitations. It's one and only limitation, and that is something that you should add when you're offering confidentiality. So whatever discussions we have will remain between you and my team until everybody is safe. All right, that is a very important, line to add. Right? I'll just quickly show it on the workbench as well, because the main point is making sure that it doesn't cause any harm to herself or to harm to others, right? So that's very important, right? What you tell me will remain private unless I think you or someone else is in danger. I will always try to talk to you first if I ever have to share this information, any of the information. Yeah. So always offer confidentiality with its limitations. That is very important. And thank you so much, Dr. Aisha, to bring it up. Yeah, I still want to reiterate that point. It's a very important point. All right. So schedule a follow-up appointment for continued support, and follow-up most probably will be with GP, or you can actually ask them to go to the LUPAS if once they make up their mind on what to do further. Right, so that's the thing, right? Understanding the situation that you're in, you are in A&E, right? You can't be offering her ongoing support, because that's not the definition of your job. You're only related to any emergency cases, any cases that would be needing admission. The person who would be offering her follow-up and ongoing support is the GP, so you want to redirect it to that. Right, so always understand your role, and by understanding your role, you need to understand which department you're in. Right, offer leaflets and contact information, provide printed information about pregnancy options, support system, and emergency contacts. Right, now interpersonal skills: maintain a calm, empathetic, and non-judgmental language throughout the consultation. Ensure clear, direct communication and avoid medical jargon. Ensure confidentiality. Reassure her what she shares stays private unless there is a serious risk. Use gentle, non-judgmental tone when discussing sexual history and pregnancy diagnosis. Always assure patient confidentiality and validate her concerns. Be prepared to provide information about confidential services like NUPAs, encourage support-seeking behavior, offer information about counseling, support groups for young people facing unplanned pregnancy. All right. So
Please like and subscribe to Turing Med School. Good luck with your preparation.